Let's talk about coronary artery disease. Heart disease affects 1.3 million Canadians and causes the second most deaths in Canada. Out of all the different heart diseases, coronary artery disease is the most common type of heart disease. So what is coronary artery disease? Usually, your heart pumps blood, which travels through your arteries to the rest of your body to supply it with oxygen and nutrients. But your heart also needs its own blood supply to function. Coronary arteries supply the heart, and when they get blocked, you have coronary artery disease. So how does this happen? Over many years, a substance called plaque builds up on the walls of your arteries without you even knowing. Plaque is made of fatty material and cholesterol and can build up anywhere in the body. It causes a space in your arteries for blood to flow through to become smaller. This makes it harder for blood to flow through and reduces the amount of blood going to the heart. The risk of coronary artery disease varies on the person and depends on many risk factors like smoking, obesity, high blood pressure, diabetes, and high cholesterol. If you do have coronary artery disease, the symptoms are unspecific and can include fatigue, pain, or dizziness. In order to diagnose coronary artery disease, your doctor will need to do a couple of tests. This could include a physical exam, chest x-rays, and an evaluation of your medical history. Some other tests can include angiography, echocardiograms, or electrocardiograms. An angiography is a minimally invasive procedure that takes an x-ray of your coronary arteries and allows doctors to view the flow of blood into the heart. This way, doctors can tell where the problem is in your coronaries. A catheter will be inserted into either the groin or arm after an anesthetic is administered to make the procedure painless and will be guided to a vein or artery close to the heart. It will release a special dye into the bloodstream that allows the blood vessels to appear in the x-ray. An echocardiogram is a non-invasive method that is used to create an image of your heart. A transducer will emit sound waves onto your chest and it will allow doctors to assess the health of your heart chambers and valves. An electrocardiogram is an additional non-invasive painless test that checks heart function by measuring the electrical activity of the heart. Doctors can then determine if it's regular or irregular. This is done by attaching electrodes to various locations on your body, which can detect the electrical activity of your heart. There is no cure for coronary artery disease, but there are treatments. Medications, lifestyle changes, and surgical procedures can be performed to slow the progression of coronary artery disease. A procedure called percutaneous coronary intervention is a non-surgical procedure that will help open up the coronary arteries. A catheter, which is a thin, flexible tube, has a stent on it. This stent is a small structure that will help keep blood vessels open in the heart. A balloon is in the stent to help open it up once the catheter gets to the blockage. The catheter gets inserted into the blood vessels of either the arm or the groin. It will then be guided through the blood vessels to where the coronary artery has plaque buildup, and the balloon will be inflated to expand the stent and compress the plaque. The stent will remain in place inside the artery to hold it open. Now, the blood flow in the coronary arteries is improved. To lower your risk of heart disease, lifestyle changes are necessary. Have a balanced diet with many fruits and vegetables. Lower your intake of unhealthy fats like saturated and trans fats, or swap them out for healthy fats like monounsaturated fatty acids, which are found in avocados and olive oil. Live smoke-free and reduce your alcohol intake. Make sure you exercise regularly, and these will all help lead to a happy and healthy heart.